I want to talk to you about hiatal hernia versus GERD or acid reflux. So, can you have one without the other? Does one cause the other? This is a question I hear a lot, and I disagree with the general consensus of how one can lead to the next or not, and I'll tell you why. So, let's define our terms first. A hiatal hernia is when your stomach, which should be below your diaphragm, which is the organ that moves up and down and lets air in and pushes air out of your lungs. The stomach should be below the diaphragm very comfortably. And a hiatal hernia, a hiatus is just an opening. A hernia is when something projects through an opening inappropriately. It should not be projecting through. So the stomach has moved up above the diaphragm. Now, what connects your stomach to your mouth? A tube called the esophagus. So I have a picture in my book, Hiatal Hernia Syndrome, where you can see here that it shows the diaphragm and then it shows the stomach below it. Now, if we turn the page, I'll show you the difference between a normal stomach and a hiatal hernia. So that darkened area is the bit of the stomach that's inappropriately elevated, and this is above the level of the diaphragm. So that's what a hiatal hernia is. Now, acid reflux or GERD, GERD stands for gastro, meaning stomach, esophageal, esophagus, reflux disease. So the stomach is refluxing its contents, which is acid, up into your esophagus, and that's inappropriate. Now, how does it happen? If part of your stomach, if you have a hiatal hernia and part of the stomach is moving up above the diaphragm, do note that 95% of all hiatal hernias are sliding, which means the stomach moves up and it comes back down. So it's an up and down type of situation. But in order for the stomach to move up, the normal opening where the esophagus passes through, the esophagus is much more narrow than the top of the stomach, has gotten spread. Okay, that opening has widened over time. So it's not something that happens overnight, a hiatal hernia. It takes time. There's pressure of that stomach being compressed and pushing up, and then starting to slowly widen, and now it can pass through, you see? So that's a hiatal hernia. When you have a hiatal hernia, you're going to have acid reflux, so you're going to have GERD. But another interesting aspect of this is you might have acid refluxing moving up your esophagus and you can't feel it. Now, why is that? Because 50%, so half of all acid reflux is silent. So they deem it silent because it's not that classic, the acid gushes up and you taste it, maybe you're spitting it out and your chest is burning and it's all very dramatic. 50% of the time, the acid just kind of creeps up the esophagus very slowly, and it tends to create more symptoms in the upper part of the esophagus where you have hoarseness, a cough, trouble swallowing. A lot of times people go to an ENT, an ear, nose, and throat doctor because they have this cough and they have trouble swallowing and they feel like it might have to do something with their sinuses. And a savvy ENT will diagnose reflux. They'll look at the vocal cords and say, no, there's acid coming up here. You know, that's so weird. I don't have the classic symptoms of acid reflux. So a little tricky with the reflux because half of the time you feel it and half of the time you don't, but it's still happening. But by definition, if you have a hiatal hernia and part of the stomach is moving up, even if it's sliding down and coming back up again, the fact that it's widened that opening, acid is inappropriately going up your esophagus. Whether it's gushing up or trickling up, it's still going up. Okay, now conventional medicine will tell you that GERD, acid reflux, can occur by itself and not be associated with a hiatal hernia. That's where I have some disagreement. Now, you can have very occasional acid reflux. You decide to overeat, you eat a very late meal, you come home, you lie down right away, the classic Thanksgiving meal, you really pushed the limit and the stomach is so overfull, it kind of pushes up and the stomach acid goes up your esophagus. this is something that happens to you rarely. In that case, it's just not happening enough that it's going to widen that opening. But if you're somebody who's been kind of living off Tums on and off, and you know, maybe you did that in your earlier years, or you just something you did and over the counter handled it, and then it got a little worse and you got more of a prescription medication. Maybe now you're on a PPI, a proton pump inhibitor, which is a prescription medication to really lower that acid. If it's happening chronically for you, this is a regular occurrence that you're feeling this irritation, then you have a hiatal hernia on its way, okay, in my opinion. So we've been doing this for decades, and here's why I say that. And in my book, The Hiatal Hernia Syndrome, I define this as a subclinical hiatal hernia, meaning it hasn't pushed through yet, but it's just really jammed up against that diaphragm. And the reason I consider that an early or really within the diagnosis of hiatal hernia is because even if that opening has not widened enough that part of the stomach has come up, due to the compression of the stomach, the elevation of the stomach, the pressure on the diaphragm, the fact that now the diaphragm is elevated a little bit, and that can get in the way of the heart, you can get into the whole cascade of symptoms associated with hiatal hernia syndrome, even though you have a subclinical hiatal hernia by definition, meaning the stomach has not pushed above the diaphragm yet. So in my clinical opinion, it's a hiatal hernia on its way, and I've seen many cases of the subclinical associated with all of these symptoms. So you can get the endoscopy by the gastroenterologist, and he or she tells you you do not have a hiatal hernia. You go, okay, I'm kind of miserable with this bloat and gas, I'm short of breath, I have heart palpitations, I feel anxious, I've been to the ER for a panic attack. Actually, one time I thought I was having a heart attack as the heart palpitations were so intense. And you've had some combination of all these symptoms, and your doctors are telling you your heart's fine, your lungs are fine, you do not have a hiatal hernia, here's your PPI, your proton pump inhibitor to diminish your acid. And those drugs are attendant with a lot of scary side effects. So we don't want to get on a proton pump inhibitor. We want to get to the root cause of why your stomach is so compressed and pushing everything up. And that cause, that treatment is looking at your whole gastrointestinal tract and seeing what's the cause of this inflammation and irritation. It's not hard to do at all. What I love about it, it's completely natural. So you're not on, there's no drugs, there's no surgery associated with really fixing this. So that's the good news. So what have we learned? We've learned what acid reflux or GERD is. We've learned it can be occasional or it can be chronic. When it's chronic, you may very well be on your way to developing a hiatal hernia. It's certainly easier to fix before that opening has gotten too wide, because the larger the hiatal hernia gets, the more complications associated with it. Generally, surgery, which I hadn't mentioned yet, does not have great long-term outcome, so we do want to avoid it if at all possible. Small hiatal hernias should not require surgery. If you have one, you've probably been recommended to get a surgery. I disagree with that based on long-term outcomes and the fact that the body knows how to heal itself once we get that pressure relieved from the stomach and it's not pushing and forcing that opening wider and wider anymore. So, can you have acid reflux occasionally and not have a hiatal hernia? Absolutely. If you have a hiatal hernia, is there some degree of reflux, whether silent or overt? Yes. And I believe if your reflux is chronic, you're on your way to a subclinical, if not an overt hiatal hernia. But the good news is it's very treatable naturally. So I hope that helped. If you're interested in getting assistance, call us for a consultation.